Hi, everyone. Welcome to this ADM Tronics shareholder update. I'm Andre DiMino. I'm president and CEO of the company. And, we appreciate this opportunity to be able to present directly to our shareholders. So this is the shareholder update for ADM Tronics on the OTCQB-ADMT for March 27th, 2024. We'll have to start with the forward-looking statement. This presentation contains forward-looking statements which are subject to risks and uncertainties, and management may make additional forward-looking statements in response to questions. Forward-looking statements are made pursuant to the safe harbor provisions of the Private Securities Litigation Reform Act of 1995. Forward-looking statements include statements with respect to the company's beliefs, plans, objectives, goals, expectations, anticipations, assumptions, estimates, intentions, and future performance, and involve known and unknown risks, uncertainties, and other factors which may be beyond the company's control, and which may cause the company's actual results, performance, or achievements expressed or implied by such forward-looking statements to differ materially from such forward-looking statements. All statements, other than statements of historical fact, are statements that could be forward-looking statements. These forward-looking statements may not be realized due to a variety of factors, including, without limitation, the factors listed under risk factors in the company's annual report on Form 10-K for the fiscal year ended March 31st, 2023. The company assumes no obligation to update the information contained in this presentation. And although this is just to let you know that this video call is being recorded and may be made available for future viewing. First, I want to thank all our loyal shareholders who have been with us for many years. We're grateful for your trust and for your patience. And we are happy to tell you why we believe our next fiscal year, ended March 31st, 2025, will be a banner year for ADM Tronics, and why this could be the beginning of major growth for our company. We have worked very hard for several years providing contract medical device design, engineering, and manufacturing services to help our clients develop their medical devices and then provide the regulatory support to help them gain FDA clearances so they can commercialize them. The revenues generated from those clients, as well as from our line of eco-friendly formulations, provided us with the research and development funds to develop our own pipeline of proprietary products without the need to pursue external funding. This strategy of internally funding our R&D avoided additional dilution of our stock. We have several proprietary medical devices in our development pipeline. These include, but are not limited to, the Vet Sonotron, a veterinary therapy device for the treatment of musculoskeletal pain conditions in animals, the Sonotron, a medical version of that technology for the treatment of chronic and acute pain condition in humans, and Oryx 3, a non-invasive therapy system for the treatment and control of tinnitus, which is commonly called ringing in the ears. The first technology we've developed, which I'm pleased to report is now ready for commercialization, is the Vet Sonotron. It's a non-invasive pain therapy device for the veterinary market. Following that, we are developing the medical version of this technology, which we intend to submit to the FDA for clearance to market for the non-invasive treatment of musculoskeletal pain in humans. The standard and most common way to treat pain today is with drugs, of course. They do work, but also bring unwanted and adverse side effects, such as drug dependency, kidney or liver damage, or in some cases, at worst, death. As you may know, opioids are an obvious example of a widely used pain drug that also brings dependency, overuse, and unacceptable adverse side effects. My late father was an innovator in a number of medical technologies. He initiated development work of our pulsed radiofrequency therapy technology to treat pain non-invasively without the use of drugs. He researched how to use various energy frequencies to treat pain and relieve inflammation. This technology achieved efficacy support in controlled laboratory models treating arthritis, where it showed no adverse effects, but a positive effect on the progression of arthritic disease, as well as in a controlled horse study of osteoarthritis, where the investigators reported a significant reduction in lameness and increased range of motion, as well as less edema or swelling in the treated versus untreated. And in humans, a randomized, double-blind, placebo-controlled study of osteoarthritis of the knee was conducted with excellent results. You may have already seen the videos demonstrating the remarkable efficacy of the VET Sonotron in treating pain and inflammation. If you haven't, you're welcome to visit our website and see them with your own eyes. As you'll see, we believe our Sonotron technology is a major breakthrough in treating pain. As part of our development efforts, we issued VET Sonotron evaluation units for veterinary field evaluations. We have received and continue to receive reports of dramatic results in treating a wide array of many pain and musculoskeletal conditions in both pets and horses. And it's very gratifying to receive numerous owner testimonials. Here's just one example from a dog owner. Quote, "The first treatment produced startling results. Angel was able to rise from a sleeping position by herself, a rarity, and walk from the carpeted living room onto the linoleum kitchen floor, something she had been unable to do for months," unquote. And this testimonial from a thoroughbred racehorse owner. Quote, "It was almost unbelievable how it worked. He would be dead lame, and an hour or so after treatment with the machine, he would be sound. We were able to get the horse back to the races," unquote. After years of development and proving the efficacy of this technology, we're pleased to advise that we are now manufacturing our first production run of commercial devices and now offering our VET Sonotron for sale for treating animals. We received pre-orders, and we have secured an agreement with a third-party leasing company that specializes in veterinary equipment leases to allow customers to secure the VET Sonotron through either a 3 or 5 year lease. We've engaged a distributor for the Southeast Asian countries, which has experience with distribution of medical and veterinary equipment in those countries, and we're in discussions with other distributors for other areas. The VET Sonotron is a professional level veterinary therapy equipment, which is priced at $21,500. As you're probably aware, the veterinary care market is an extremely large market. In fact, there are a number of companies which have very, very high valuations. As you can understand, people are spending more and more on the care of their pets, as well as the significant investment that are made to keep thoroughbred, standardbred, hunters, jumpers, and other horses healthy and performing well. We believe an effective therapy that has no known or reported side effects has the potential to generate significant revenue and profits. For example, if we are successful in generating sales of 200 units this coming year, which we believe is a conservative number, that would result in excess of $4 million in new revenues for ADM Tronics, which could contribute about $1 million to the bottom line. As mentioned previously, now that we have completed the development work on the VET Sonotron, we're beginning to devote our engineering resources to developing the human medical version, which is the Sonotron. In addition to the studies we've already conducted, we're planning to conduct additional clinical human studies, and then we plan to pursue a 510(k) clearance from the FDA to market the Sonotron to the U.S. medical market. As you may know, the FDA 510(k) route is a less onerous and time-consuming route to marketing a medical device in the U.S. than an FDA PMA. We understand this FDA pathway very well, as we have been guiding clients through it for decades. We're already in early discussions with interested parties that can help conduct the human studies at well-known medical centers. We believe the VET Sonotron and the Sonotron for humans could be transformational for ADM Tronics. Pain is a multi-billion-dollar market, and we believe we have a major breakthrough for animals and then for humans. In addition to the VET Sonotron and Sonotron, another of our proprietary therapy devices in development is the ORX3. This is a non-invasive therapy device for treating tinnitus, which is ringing in the ears. Tinnitus is a hearing condition with tens of millions of sufferers worldwide. In many cases, it is so severe that it results in depression, anxiety, and even suicidal thoughts. We previously developed and manufactured the original version of the ORX3, for which we successfully secured a 510(k) clearance to market in the U.S. for the treatment and control of tinnitus. Although it did produce promising results, it was difficult to use due to its analog controls, as well as its handheld probe, which impacted its overall market potential. We've now developed the ORX3 V2, a new digital version that is a convenient wearable and is much easier to use through a smartphone app. We are currently in the process of preparing to conduct studies to submit to the FDA to pursue a 510(k) clearance for this new version. In addition to our pipeline of proprietary medical device technologies, we continue to support clients with our engineering, development, regulatory, and contract manufacturing services in our FDA-registered and ISO 13485 certified facility. This, as well as our eco-friendly formulation, continue to generate revenues to support our ongoing research and development activities and expenses. One of our clients is Origin Life Sciences, for which we were retained by them to develop their plasma-generated nitric oxide, or NO, technology, trademarked the Ionojet. This technology is for the treatment of several indications, such as diabetic foot ulcers, onychomycosis, which is also called toe fungus, and several other indications and diseases. The initial controlled human study on diabetic foot ulcers was successful, and they are now planning for a pivotal study to submit to the FDA. Origin is in the process of securing additional funding, which will enable them to retain ADM Tronics to continue development work and support them through the FDA process. This would be a large contract for ADM Tronics that has the potential to generate substantial revenues for the company. Regarding our stock, well, I know many of you have commented on the low price, and we actually believe the price is exceptionally low. And with our launch of the VET Sonatron now, along with the pipeline of additional medical device technologies like the Sonatron and the ORX3, we feel this represents an extraordinary buying opportunity and a major turning point for ADM Tronics, as well as our loyal shareholders. So in closing this brief presentation, I'm sure you understand, we believe now is an excellent time to seize the opportunity to invest in ADM Tronics and to tell everyone you know about the VET Sonatron, especially if you know veterinarians and horse owners. If you haven't seen the videos that demonstrate this excellent pain treatment, you can go to the vetsonatron.com website, as well as our YouTube channel at youtube.com/@ADMtronics, and see for yourself. Many who have tried the therapy are shocked at how well it really works. I appreciate everybody joining the call today. So in the remaining time we have, I'd like to open it up for questions. I'll do my best to answer them. If you do have a question, in order to keep it orderly, if you could please use the button, the icon at the bottom to raise your hand, and then I'll be able to call on you. Okay, so I see David Fishman. David Fishman has the first question.
Okay. Hi, Andre. Thank you so much. I have two questions.
Sure.
Would the human would the human device be cheaper than the animal device, or be about the same?
It may actually be a little bit more expensive because we're putting into it a number of controls, for example, touch screen and so forth. We don't anticipate it being much more expensive, but I anticipate it being marginally more costly than the veterinary version.
So it's not for personal use; it's for like a doctor's use.
Yeah, as a matter of fact, the FDA clearance for a device like this would be by prescription only, and typically it's called by or on the order of physician. And we anticipate that this would be acquired by physicians, clinics, and hospitals that would be treating pain. Of course, the many pain clinics that are out there as well.
All right, thank you, Andre. And one last thing: is there any results from the trials that were done on the animal thing from last fall?
I think you're referring, I don't know which studies you're referring to.
Well, a national chain like a Walmart.
Yes, yeah, that's a good question. Yes, the results there were successful. That wasn't an actual clinical study or trial. That was really an evaluation, and they had very good results with that. And we are anticipating, and we're hopeful that that's going to go forward with including that in a major chain.
All right, thank you.
Sure. If someone else has a question, if you click your raise hand button. Anyone else have a question?
I thought I had my raise hand button up.
Is that Mark? Mark, is
Yeah.
that you?
Yes. Hi, Andre.
Hi, how are you? Go ahead. Sure.
Good. Yes. My question is there patents or patent pendings on the Sonotron devices?
Yes, we have patent pendings on all of our devices. We're very strong on the intellectual property area, not only for ourselves but for our customers. We've developed over 50 patents or patent pendings. Of course, when we develop them for a client, it belongs to the client, but we are the inventors. But for our own devices, we have filed and we have patents pending for the Sonotron and that Sonotron and the URX3 as well.
Fantastic. There's another couple of products I was wondering about. The Ventus respiratory device, is that still in the works, or?
So that was a customer of ours, and we completed the contract for them in June of last year. We worked on that for about 18 months. And now the company is going forward, looking for bringing the product to manufacturing, which it has not done as of yet. So we're hopeful. It's a very good device, and we think it has certainly potential in the market, and we do hope that they're able to bring it into manufacturing.
Oh, so you won't be doing the manufacturing?
We don't know yet. They haven't decided.
Oh, I see. And then the other one is the alveo respiratory device.
Sure, the alveo respiratory device, that's with the company Alveo. They've moved now into the Mayo Accelerator Clinic, which is up in Mayo in Minnesota. And so they've gone through and they've won a couple of small grants, and they're continuing to seek funding to bring that product forward. We did develop the product. It is ready to be manufactured. We're just waiting for that company in order to get the proper funding to be able to support that.
Great. Thank you so much.
Sure, Mark. Any other questions? Ben.
Hi, Andre.
Hey, how are you?
Good, you. Question, how many you can, produce monthly of those if you receive a large order or, for someone?
Sure, it is a complex device, and we anticipate that we could produce if we, hopefully it's a luxury problem, but we anticipate that we can produce approximately 60 to 70 units per month.
Oh, that's great.
That's right now without any additional investment, just with our current capability.
Okay.
I have another question.
Okay, David.
You mentioned earlier could bring $1 million to the bottom line. I missed what would have to happen for that to happen. Can you repeat it? Thanks.
Sure. Yeah, we said that if we were lucky enough to be able to sell 200 units in the coming fiscal year, that would bring, with the $21,000 plus wholesale pricing and so forth, approximately $4 million in additional revenues to ADM, which could bring about $1 million to the bottom line. And that would be with the 200 units that I suggested.
Okay, thank you.
Sure. Anyone else?
I have another question, Andre.
Oh, sure, Benjamin.
Yeah. What would be your gross margin on a product? Any idea?
On the Vet Sonotron?
Yeah.
Yeah. So right now we're producing it in what I would consider to be small numbers. We don't have the economies of scale. However, right now we're talking about, multiple, several 100% markup on the product.
Okay. Thank you.
As we get economies of scale, that will be reduced. Some of the materials that we're producing are actually very custom made. They don't exist, and so we literally are making those in our facility. So as we go forward, we'll produce various fixtures and so forth to manufacture them in quantity. So the cost per unit will actually decrease over time.
Also, yeah, so not many people know what would you be like, making vet offices through the country or through the world? How are they gonna find out about the product and stuff?
Well, that's why we're trying to find distributors for certain areas. We're fortunate. We have an experienced distributor in Southeast Asia, which has big marketing campaign, social media, and so forth. We've dealt with them before. We're looking for other distributors that can support that. As you can understand, we're a technology and development company, so we try to look for synergistic partners that can join with us to get the product out there, market it, distribute it, and sell it for us.
Okay, thank you.
Yeah. Do we have anybody that's savvy marketing that can be brought into the company to hasten this up?
Yes, we're actually in discussions with two individuals right now that have experience with equipment, both medical equipment and this type of equipment in this price range. And so we're looking to see what we can do to bring them in.
All right, thank you, Andre.
Sure. Mark, your hand's back up.
Hi again. Yeah, I was curious, aside from contracting with marketers, are you planning on doing advertising like in veterinary magazines or journals as well?
Yeah, we're hoping to get some of the studies that we've done to be published in journals. That would be I would consider technological market. But then in addition to that, we are looking for paid marketing and distribution information. I can tell you that it is two separate markets. You know, when we look at the veterinary market, and we've already done some market research in this, they're two distinct markets. You know, the equine or horse veterinarian and horse owners is one distinct market, and then the small animal pet care and so forth is a different market really. So you know, we're looking at it as kind of dividing those two and looking at how to approach both of those markets.
Thank you.
Art Ballinger, I think you had your hand up.
You got me. Okay, good. Thank you. It sounds like an exciting year coming up ahead. Look forward to it very much. Any thoughts of making it even more exciting by buying back some of your stock at this price?
We certainly would like to do that. Right now, we're committing all of our excess funds to R&D. I could tell you if some of these things start to generate the revenues that are there, and if this stock doesn't perform better than it is, believe me, that's going to be an easy decision to buy some of that stock back, even myself. So it certainly is capable of doing that once we know that the revenues are there if the stock doesn't follow the benefits that we're doing.
Good. Okay, Andre, all the best to us.
Thank you. Appreciate it, Art. Okay, Rob James.
Yeah, thanks so much for the presentation today. Really exciting times.
Thank you.
Curious to get your thoughts on what the size of the market is for these individual products.
Sure. Well, you know, I've been on a lot of these investor presentations where they talk about, you know, a $50 billion market and we're going to get 5%. I didn't want to do that. But I can tell you that the U.S. veterinary market itself is a $65 billion market. Now, of course, that's the overall market, which includes drugs and everything else. But there's not specific information on the veterinary therapy equipment market. But we did find something that leads us to believe it's approximately a $6 billion market. But that includes things like X-ray equipment and so forth. So I believe it's a subset of that. But nevertheless, it is a very large market for us. And, you know, again, without talking about percentages, we're only talking about hundreds of units, which could be, you know, transformational for the company. As I said, 200 units alone would bring $4 million to the company new revenues. But there are tens of thousands of veterinarians, horse trainers, and other locations that could use the product. So I think the opportunity is very large for the veterinary product. And of course, the Sonotron market is actually will dwarf the size of the veterinary market because the Sonotron for human medical applications is much larger.
Excellent. Thank you.
Thank you.
One more question, if you don't mind.
Sure.
So the veterinary product is 21,000, I think you said.
Yeah.
Is it then a razor blade model where you get a licensing fee for each
So we
time, or is that
we actually have two versions of the product. One is an outright purchase, which is 21,500, or they could put it on a 3 or 5 year lease with the veterinary equipment leasing company. But we do have a version of the unit which is on a pay-per-use basis, which there's a metering system. The system delivers a 15-second output with a 5-second shutdown, and that's called a treatment unit. And depending on the size of the area being treated, for example, a small dog, you might use 3 to 4 treatment units or about a minute of therapy. Let's say on a horse's hock, you might use 12 treatment units or about 3 minutes of therapy. And so we have a system which meters the number of treatment units. We have it would be cloud connected. And as you use up the treatment units, it would go down. And then as it gets to a certain level, they would pay for additional treatment units. And this way, in essence, they really will not own the device. They would use it. They would have it on a pay-per-use basis. We haven't launched that part yet. We're actually in the process right at this moment of putting together the back end there so that we have that automatic loading and charging of their credit card. So that will be introduced probably in about another month or so. Right now, we're offering the unlimited unit for 21,500, and then later on we'll be offering the pay-per-use version.
Okay.
That's really great. I just want to say that's beautiful. Thank you, Andre. That's high tech, really.
Yeah, thanks. Yeah, we anticipated that because we do know that there are certain single operative veterinarian offices that may not be able to afford a $21,000 device, and we felt that if we could give them the therapy even for a short amount of time, the minimum for that it would be a 6-month usage. So if they used it for 6 months and they saw that it was going well, then they may purchase an unlimited version or just keep on using it on the pay-per-use basis.
Yeah. Congratulations on that.
Thanks. Any other questions?
I have another one.
Sure, Benjamin.
Yeah. How long do you anticipate to take, for 5, 10, to apply for it? And how difficult will be to change the vet Sonotron to human version?
So we're in the process right now of modifying the veterinary version. You have to understand the therapy that comes out of the device is identical. It's really the controls and so forth that are being changed. So we have our electrical engineers and our software engineers that are on staff here that are working on that now. There's some mechanical change that'll occur. So we anticipate that's going to be about a 3 to 4 month process. Once that's done, before we can submit to the FDA, it has to go for 60601 safety and EMC certification, which is done from a third-party lab. That's a couple of months process. And then, the FDA 510K process statutorily is 3 months, but they can go as long as 6 months. So we're really talking about, I say, on a conservative estimate, about a year from now, a little more than a year from now, where we hope and anticipate that we can get it FDA cleared for human use.
Great, thank you.
I have a last. I'm
Okay,
sorry.
Dave.
Yeah.
Sure, no problem.
Yeah, I wanted to ask. I know you've been visiting some brokerage offices. Is anyone writing this up from the brokerage community?
Not yet. We are working on that, and we're speaking to some people. I can tell you, obviously, with the market that we're in right now, it is hard to get the attention of a company. And although we're a real company with employees and developing products and so
Yes,
forth,
I know.
unfortunately, with the stock trading at this level, sometimes that paints a bad picture against us. But we are a real company, and we're hoping that somebody takes notice.
Okay, thank you.
All right. Any other questions? I'm gonna wrap it up now, and I really appreciate everybody's time today. This is really the first time that we've done something like this. I think it was a good way to present the technologies that we're working on and how excited we are about the future that we're facing and all the hard work that we put into it. So again, I want to thank all of our loyal shareholders for supporting us and for your patience. But we are getting there. And again, if you know any veterinarians or horse owners, please tell them about the technology. And don't forget to visit our YouTube channel. I think you'll find it interesting to see those videos. All right, everybody. Thank you very much. Have a good week and a good weekend.
Congrats.
So long.
Thank you. Thank you.
Bye-bye.
God bless.
Thank you.